Good afternoon, everyone, and welcome to the launch of the Critical Medicines Alliance. With us today are Deputy Prime Minister and Minister of Social Affairs and Public Health, Frank van den Broeke, and European Commissioner for Health and Food Safety, Stella Kyriakides. They will both make a statement first on the Critical Medicines Alliance, and then we will open the floor for some questions. Minister, you have the floor.
Thank you so much. Ladies and gentlemen, this afternoon we have a very important moment in our action on medicines shortages. I'll very briefly give the context, and Commissioner Kyriakides will then go into depth into the initiative that is presented this afternoon. The context, I guess, is well known. In all European countries, we are increasingly struggling with shortages of medicines, sometimes very critical medicines. And so we see patients who have to travel hundreds of kilometers to find the drug they need. We see pharmacists working 10 hours a week just to find the drug that is needed for the patient that is in their office. We see doctors increasingly frustrated about the fact that what they prescribe is not on the market, is not available anymore. The reasons for this situation, which is unacceptable, the reasons are multifaceted. It's partly industrial problems. It's partly the fact that over the last 20 years there's been a shift in the production, notably of generics, away from Europe to countries like China, India, and also a concentration in the supply chain which makes them very, very vulnerable. The issue is about production context. Obviously, in Europe, we are demanding in terms of social and ecological standards, and rightly so. In other parts of the world, that is less the case. But it's also an issue of the way the market functions. Sometimes you have in one country still supply, you have a reserve capacity, whilst in a neighboring country there is a shortage. And so, since this is such an urgent issue, in May 2023, we, and that is 23 member states, launched a call for action. We took that initiative, and very rapidly we had 22 colleagues joining us in calling for immediate action on shortages of medicines. And in the paper we then published, basically there was a three-pronged approach. In the very short term, we said we can immediately organize a much more efficient solidarity within Europe, even on a voluntary basis. You don't need any new legal framework. And indeed, that has been established meanwhile. We have now, within the European Medicines Agency, organized by the MSSG, that is the Medicines Shortages Steering Group, within that body, we have now a well-organized voluntary solidarity mechanisms, which allows one country that is confronted with a shortage to ask for help with other countries. And that is now up and running, which is very important. That is solidarity in a case where there is one country lacking something, whilst in other countries there is still supply. Secondly, we asked for an action that needed a little bit more time. That is, we said, let's try to establish a list of critical medicines at the EU level, substances, APIs, which are absolutely needed, which absence can be life-threatening. Let's establish such a list and then look into the vulnerabilities that are out there in supply chains and see what we can do. There, a lot of work has been done. So EMA and HERA and DG Growth have been working on this. The Commission, HERA and EMA have been working on this. We have identified at EU level a list of critical medicines. This is basically 250 substances, 250 APIs, active pharmaceutical ingredients, which are indeed critical, which are badly needed, for which there are no alternatives. And on the basis of those 250, a more narrow exercise is now ongoing, focusing on 11 substances, for which there is a mapping organized to see exactly where the vulnerabilities and the risks are. That work is being done at this very moment. And that is important because in this way you can be better equipped, you can be better organized when a risk materializes. And then the third prong of our proposal back in May 2023 was a bit longer term. We had the idea that this crisis is so multidimensional that you need a battery of instruments, also legal instruments. You need to think in a new way about procurement, the kind of criteria you use in the procurement of medicines. Should it only be price? No, that's a bad idea because we've been pushing some prices too low. It should also be other criteria, such as security of supply, so procurement. The necessity to be able to reshore, to bring back to Europe some basic medicines production facilities, which then is an issue both of possible funding, the legal framework, the idea that you might have to innovate in terms of the way you pay for your drugs. You think about antibiotics. You don't need to use them too much, rather on the contrary. They must be available when you need them, but not in abundance, just when you need them. So then there is this idea that you might think of a different way of paying for them, like Netflix. It's you say they must be available, and when we need them, we can have them. So you pay for reserve capacity. HERA is working on this. So we said, and this was, let's say, the umbrella idea for the longer term, we need a battery of instruments, which is also a battery of legal instruments. We need a Critical Medicines Act. And I was absolutely delighted that the Commission and Stella Kyriakidis in person has been so expedient in jumping on that call and going immediately into action. And so we had a very comprehensive communication on medicine shortages and how to tackle them by the Commission in October, whereby the Commission said, look, a Critical Medicines Act, your longer-term proposal, that's fine, but let's not wait until everything is ready and studied. Let's start the action here and now in a very pragmatic way. Let's bring together the actors. And that is the Critical Medicines Alliance. So I will now let you listen to the Commissioner who can explain what that exactly means, but that is what we will launch this afternoon, and I'm absolutely delighted for all those patients, all those pharmacists, all those medical doctors who are confronted with these shortages. Stella.
Thank you. And thank you. And as Deputy Prime Minister has said, it is an important moment, and I'm very happy that you're all here to share it with us today. Over the past 4.5 years, you have heard us many times saying that we have been working together to build a strong European health union. And we have made important progress in this direction. But from the very beginning, we also said that access to safe and effective and affordable medicines are a core part of this work. And today, with the launch of the Critical Medicines Alliance, we're taking another, we believe, significant step in delivering on what the expectations of our citizens are. At its launch alone, this alliance brings together some 250 members across the health and the industry spectrum. And this shows the strength of the commitment we have towards this goal. We want this alliance to deliver immediately, to identify the best measures to address and avoid shortages of some of the most critical medicines. The issue of medicine shortages, as has already been said, is not new, but it has been exacerbated by the COVID-19 pandemic and by the geopolitical challenges that we see in recent years. And these have exposed the vulnerabilities in the EU supply chains, which are causing periodic shortages across the member states. So we have to be able to anticipate possible disruptions for the future to boost our strategic autonomy and also ensure diversified supply chains. To achieve this, we felt that we needed a different way to do things, and we have already been working towards this. On the regulatory front, as some of you may know, we proposed a historic reform of the EU's pharmaceutical legislation to create a true single market for medicines and to ensure equal access for all patients. I want to underline here that we welcome that the European Parliament is ready to start negotiations, but I would also want to say that equity must remain at the centre of this reform. Ensuring equal access in all member states must remain the key objective. The alliance we are launching today builds on the ongoing work of the pharma reform and several European Health Union initiatives, such as the extended mandate of ECDC and the establishment of the Medicines Shortage Group. A voluntary solidarity mechanism, as you have heard, is already in place to allow member states to support each other in case of shortages, and this has already proved its worth a few months ago. And we have also, as has been said, established the first ever union list of critical medicines to monitor the most essential products. But now there was a missing part in this puzzle, and I want to take the opportunity to thank the Belgian presidency, but also Deputy Prime Minister himself for the personal commitment and the support in getting us to where we are today. I think that this shows that we are all working in exactly the same direction. What we are today addressing is the industrial dimension of shortages, because with our alliance, we're bringing together all the relevant forces that we need to do so that they can work together, the stakeholders, industry, the civil society, the member states. And this is what citizens expect for us, this new public-private partnership that will start with cooperation and concrete action. So what we first did, we completed a pilot analysis of the vulnerabilities of a first set of representative critical medicines that are part of the EU list. And this gives us a very good starting point in order to be able to explore the strategies we need to strengthen Europe's production capacity and to look into innovative manufacturing technologies. Secondly, we're going to be looking at ways to diversify our sources of supply for critical medicines. And this alliance will support the development of a set of industrial instruments to address the challenges we face. This could include joint procurement. This could include capacity reservation contracts, as we did with EU-FAB, or funding opportunities for strategic projects or even strategic partnerships with third countries. One of the first deliverables of this alliance will be the joint development of a strategic plan by the end of this current year, 2024, with very concrete and actionable recommendations to put forward. So in ending, I'm convinced, as I think we both, if I may say, are convinced that this alliance will contribute significantly to the EU's open strategic autonomy and resilience. But I think we're all even more convinced that it's only by working together as part of a strong European Health Union that we can produce concrete solutions to address shortages of medicines and really ensure that patients are better protected and European citizens get what they really deserve in the area of health. So thank you very much.
Thank you very much, Deputy Prime Minister and Commissioner. We open the floor for some questions. Please state your name and your media, please.
Hi, Agnès Faure for Context. I have a question. It looks like member states are counting a lot on the work that will be done by the Alliance to find the solution that they are not finding on the next step to ensure best practices on security of supplies issues that you just talked about this morning during the informal. So why would it be different for the Alliance to find solutions that member states can find alone? I mean, if it's already difficult to find common solution at 27, how easier it's going to be at 250?
The reason is that this is a European, and I would even say an international issue par excellence. It's simply impossible to find national solutions. Let me maybe return to the first short-term solution we already are now putting in practice. That is, you organize solidarity between member states. You need more than one member state to do that. if we have a shortage of a drug, and for some reason there is still a reserve capacity and sufficient supply in another country, it's only by organizing solidarity at EU level that you can solve this by definition. But secondly, in order to understand let's say the problems in the supply chain, which are global par excellence, you should do the analysis of those vulnerabilities together at EU level, and that's what we are now doing with this list of 250. It makes no sense to do that effort in 27 capitals separately. It makes no sense. You have to do it together. But then to the key of your question, the essence of your question is about the Critical Medicine Alliance. There are many reasons why you have to do that, first of all, at the EU level, and there are many good reasons to do that with the stakeholders. First, why the EU level? Let me give one example. A number of years ago in Austria, the Austrian government was confronted with the fact that I think the last production facility for amoxicillin would be closed. They said that's a problem because we will become even more dependent on supply from elsewhere and from a long distance for amoxicillin. And so they wanted to give a new life to that production facility. But obviously, one of the reasons why it's so difficult to have that in Austria or in whichever European country is because the standards we set on pollution, on protection of the environment, on safety are very, very high. And so it is simply not possible to give a new life to such a production facility for amoxicillin in a European country without support. You need state support. You need state aid. Then the Austrian government ran into a difficulty because they had to notify that to the European Commission, and understandably the European Commission said, yeah, but that's kind of a basic stuff. That's basic stuff. Why do you need state aid? A long discussion. After 3 years, I think the Commission said, yes, okay. But so you are squarely in a European legal context where you need a legal solution or at least a practical solution at EU level. And so one of the first missions for this Critical Medicines Alliance is indeed to identify problems of funding, to make it possible to reshore, to re-enter in Europe production facilities, respecting the standards the EU sets for quality, environment, etc. Therefore, you need funding at EU level. You need an EU framework. So that's an EU question par excellence, given the internal market. Now, why then involve also the industry? Because obviously, they are very much more knowledgeable about both the problems but also the potential for solutions than we are. And so it's really something on which we have to work together. So the alliance is about identifying priority problems, priority potential for solutions, but it's very much solutions you need at EU level. Let me give another example. Partnerships. Suppose you say the solution for this type of drug is not bringing production back to Europe, but the solution is that you should secure the supply chain with a more robust kind of framework between you and third countries. But that's something you have to do at EU level if you want to do it well. And I could give other examples, but joint procurement per se. So the solutions are par excellence European solutions because it's an international problem. And the reason why we involve stakeholders, the industry, patient organizations, the healthcare profession, is because there is such an urgency that you cannot wait. And so in the alliance, there will be 2 working groups, one on issues of funding and reshoring, one on partnerships, because that's key. That's not the only thing in the story, but that's key. So it is simply impossible for a single member state to address this issue.
Thank you. I'd like to start from where Frank stopped and he said it's simply impossible for a single member state to address this issue. I think we can all agree that shortages are due to many different factors and many different variables. There's nothing that we can really put our finger on that there's one reason. I would also like to believe that we can agree that following what we all experienced with the unprecedented health crisis of the pandemic, we saw that in some situations the EU needs to work together, member states are stronger together, and we can deliver when we're working together. This has already shown its proof. We mentioned earlier the solidarity mechanism, which allows member states under exceptional circumstances, if they have shortages, to exchange, to support each other for medicines. And this has already happened in the last few months for supporting a member state which had a shortage in cancer medicine. So the concept and the understanding and the principle of stronger together as 27 is something that is the way forward in many of the areas that we're dealing with in health. The alliance, in the alliance, member states will have a key role to play. They're represented. They will have 6 representatives in the steering board, they will be invited to take part in the alliances forum. But what the alliance provides, if I may use the word, is a kind of a platform for member states to be able to coordinate with each other, with the EU, but also with the other private actors that need to be addressed. So this will be typically in the case when we're dealing with issues to do with incentives or with the support of medicine production in Europe. We are bringing everyone together, not only the member states, but also industry, also NGOs, also the civil society, this is, I believe, a different way of approaching it, but a necessary way of approaching it, because in this way you have different views coming in, and when you have different input, you're able to find ways to go forward. No one member state can deal with this alone. This was a topic, medicine shortages, we mentioned it this morning. My first steps go since December 2019, before the pandemic. Member states came and said, let's do something about medicine shortages. Now we're moving forward, and I think this alliance is really a very sound way of changing the landscape in terms of shortages. Thank you.
Hi, Marta Iraola for Euronews. This Critical Medicines Alliance is a part of the bigger plan to address shortages, also includes the pharmaceutical legislation. So I just wanted to know, because, well, as you mentioned, the first strategic plan will already be published by the end of the year. And it seems that the negotiations on the pharma legislation are going a bit slower, just to how these two processes will complement each other now and in the future.
I'll say one sentence and then I turn to Stella Kyriakides. The alliance, obviously, is not an authority that will issue legislation or organize or fund something itself. The alliance is a preparatory and mobilization body. It's also a consultation platform, but it's preparatory, and so it will not issue legislation. And the strategic plan, the alliance will have a life cycle of 5 years to start. So the strategic plan should be a comprehensive approach, in which obviously legislation might fit in. However, the pharmaceutical package, that it is in the pipeline, it follows its own dynamic. There is a link with shortages. I would not like to comment on that now in my capacity as chair of a number of discussions, but maybe for the Commission, the Commissioner can say more on this.
Yes, well, as you know, we put forward the pharmaceutical package, the reform, and of course I have already mentioned that we welcome the fact that the position, that the Parliament has already discussed this and taken a position. I will again say that at the same time we will continue to to defend the objective of this package, which is to ensure access and availability of medicines to all 27 EU member states. Now, in terms of the way forward, it's going to be further discussed by the institutions, by the Council, and it will come to us again to discuss in trilogues. I would ask all to really move forward with this as soon as possible, because it's a central part of the European Health Union that we have all been building together.
Yeah.
So,
yeah, maybe just one word. Indeed, we are now working among the member states, and the Parliament is working on it. It's 2 tracks, and then these tracks have to find each other. And we did give priority within the working party among member states to the shortages dimension, because there is an intrinsic link with shortages. Then there is the incentives dimension. But indeed, the basic philosophy of access to all, there should be no first-class and second-class EU citizens when it comes to drugs and medicines. That's a philosophy we share very much with the Commission.
Carole Stava from Mediquality. What do you think are the big challenges you're going to face too?
Frank?
The big challenges. Well, first of all, today I'm more in a kind of an optimistic mood. I see a lot of potential, first of all. I think, if I may, the challenge is that this is as much about pharmaceutical policy, and thus about, let's say, health and healthcare as about industrial policy and economic policy. And so we have to join forces with the ministers of industry, which obviously are very much involved in this idea of launching such an alliance. So it's an industrial policy issue, it's a pricing issue, because if you push your prices too low, if your procurement is one-sidedly only focusing on price, and not on security and more quality aspects of a tender, so you are in a very broad domain: industrial policy, economic policy, pricing policy, reimbursement policy, healthcare policy. That is the challenge. But I think with the alliance, we take the adequate initiative to tackle such a broad challenge.
I would agree. Today is really a day we're looking forward, and we feel that it is already having a positive momentum in terms of it being the first time that it is bringing these actors together. But of course, it is an alliance which is a consultative body, and everybody will be coming in with their own proposals. I believe that the positive side of this is that they will be bringing diversified proposals to the table that can be discussed. And in this sense, what could be the complexity is what Deputy Prime Minister has already said, that it needs to cooperate with the national competent authorities on pricing, on reimbursement, and others. So it's finding this way forward. But there is a very positive momentum to the fact that this is the first time that this is bringing everyone together, and this in itself shows a shift in the way that we're dealing with the issue of shortages. And also the shift is the fact that, as was said, and I think it needs to be highlighted, you cannot address these issues unless you understand them. The fact that now we have an ongoing project to look at the vulnerabilities, the why, you're able to see then where I need to focus my actions. Otherwise, what you're doing, you may think you're addressing the root causes, but you may not, in fact, be doing this. So in that sense, I think that this is the way forward.
I have a second question. Medicines such as Ozempic, are there in plan to be the shortage, the lack of medicines such as Ozempic, are there planned to be?
Ozempic is a bit a different story. Ozempic is a story where there is a growing demand in the market. That's kind of an announcement effect, obviously, and there's been a lot of publicity about what Ozempic might do for people with obesity, whilst the market authorization is for diabetes. And so Ozempic is a story whereby you have a kind of an explosion in demand or potential demand, and a lot of off-label use, which is the reason why in Belgium we really intervened and said, okay, the priority use is for diabetes and for severe obesity, which we define. And so we try to keep the prescribing practitioners to that. But that's because of a change in the demand profile, and a very important change in the demand profile. It's a bit a different story, I would say. It's not a story whereby you have a production facility that is in difficulty like we had with Thrombolytica. This was a production facility in difficulty and creating breaks in the production, or situations where you have a supply chain starting in India or China which suddenly stops. That's a very different story.
Any more questions? And if not, I'd like to thank the Deputy Prime Minister and the Commissioner, and thank you all for coming. Have a good afternoon.
Thank you.
Thank you. Thank you.
Okay, go for the next photo opportunity. Okay.